Hello, my name is Andreanna Ulery, and I will be presenting on the current global mental health crisis. I'm currently a sophomore at Saline High School, located in Saline, Michigan. I am very interested in the field of psychology, especially the correlation between genetics and development of mental illness. Learning about mental illness is a particular passion of mine, and I especially seek to address and solve current issues relating to the mental health crisis. In the future, I hope to either pursue a career in research or practice as a physician. Today, I will be examining the prevalence of mental illness across the globe, identifying the most common mental illnesses in the world, and examining both the current stigma and the number of preventable deaths from mental illness globally. Mental illness has become a crisis across the world, as we can see from this graphic outlining the prevalence of mental disorders globally in 2020 and 2021. Unlike many other global health issues, mental illness sufferers face a debilitating stigma that often prevents them from feeling like they can reach out for help. Many global citizens are also not appropriately vetted in the symptoms of certain mental illnesses, and therefore do not know how to approach or understand those with mental illness. The global issue of mental illness is something that must be addressed due to a rising prevalence of cases, a rising number of preventable deaths, and a stigma that continues to persist. Though mental illness cases have been on the uptick for the past several years, the coronavirus pandemic contributed to a remarkable increase in cases of illnesses such as anxiety and depression. This first graphic tracks the prevalence of anxiety in several countries around the world. As we can see, in some nations, even before the coronavirus pandemic, rates of anxiety were quite high. However, the significance of the coronavirus pandemic on these rates of anxiety cannot be denied, as many nations saw a remarkable increase of anxiety. This second graphic shows the increasing prevalence of depression prior to and after the coronavirus pandemic. As stated earlier, it is important to recognize the significant rates of depression and anxiety existing in these countries prior to the coronavirus pandemic and how the rates skyrocketed during the pandemic. The 2020 statistics in these graphics show an appreciable increase of mental illness across the entire globe. Though these graphics only depict depression and anxiety rates, please note that other mental illnesses have also seen an increase in prevalence globally as well. Mental illness has seen an increase in prevalence, as we've just established, with about 1 in 7 people, or 11% of the world, suffering from a mental health disorder. Many of those suffering from mental disorders across the globe suffer from one or more of the 4 most common mental illnesses: anxiety, depression, substance abuse disorders, and bipolar disorder. Anxiety is the most common mental disorder in the world, with about 284 million people estimated to be diagnosed with it. Please take into account that when I say anxiety, I am referencing those with anxiety disorders, which includes generalized anxiety disorder, panic disorder, and OCD, amongst others. Anxiety in the past few years has overtaken depression to be the most common mental illness, with an upward trend we can see very starkly in this graphic. However, the first step towards starting to address these rising numbers of mental illnesses is to learn the symptoms. That is why I will be sharing a few of the symptoms of each mental illness along with the current rates of said illness. The symptoms of anxiety specific to generalized anxiety disorder are excessive and uncontrollable worrying, restlessness, difficulty concentrating, sleep issues, and other physical manifestations such as nausea and headaches. Depression is the second most common mental illness worldwide, with an estimate of about 264 million cases. As we can see from this graphic, many cases are concentrated in middle to low income regions of the world. It is important to recognize the signs of depression as depicted in this second graphic. Depression is characterized by prolonged depressed mood, loss of enjoyment in previously enjoyable activities, social withdrawal, fatigue, weight fluctuations, difficulty sleeping and concentrating, and suicidal ideation. Substance abuse disorders, specifically drug use and alcohol use disorders combined, are the third most common mental illness in the world. According to the UN Office on Drugs and Crime, over 35 million people suffer from drug use disorders, and according to the World Health Organization, about 107 million people have alcohol use disorders. Substance abuse disorders are characterized by an inability to control usage of addictive substances such as drugs and alcohol. Often, addicts display erratic behaviors as they try to procure more of the addictive substance. Globally, about 46 million people have bipolar disorder, making it the fourth most common mental illness in the world. Bipolar disorder often consists of alternating manic episodes and depressive episodes. Symptoms of manic episodes consist of elevated mood, increased energy, exaggerated sense of self, distractibility, and poor decision-making. Depressive episodes are when a person exhibits depressed mood, weight fluctuations, fatigue, sleep fluctuations, and suicidal ideation. The World Health Organization estimates that between 76 and 85% of people living in low and middle income countries do not receive any treatment for their disorders. In addition, between 35 and 50% of people in high income countries do not get treatment. A significant barrier uniting both low and high income countries in a lack of treatment: stigma. This discrimination stems from a misunderstanding of certain mental conditions and generalizations such as all mentally ill people are violent. Though this graphic consists of results from surveys taken in just the United States, it demonstrates a lot of the negative thoughts that society has towards those who are mentally ill. The second graphic shows a variety of ways that those with mental illness have been stigmatized across the globe, from preventing them from owning their own homes to not allowing them to use swimming pools. The global impact of mental illness is undeniable. As we can see from the graphic, there is a massive loss of productivity in the global economy due to just anxiety and depression, 12 billion days to be exact. The impact of this lost productivity? An estimated cost of $16 trillion between 2010 and 2030. In addition, unchecked mental illness has the potential to exacerbate other public health issues. For example, some mental illnesses are associated with non-adherence to other medical guidelines, such as those outlined for infectious disease. Finally, higher global rates of incarceration for those who are mentally ill may contribute to financial strain and, unfortunately, higher rates of recidivism. 8 million. This number, as of 2015, signifies the number of deaths due to causes associated with mental illness yearly. These are lives that, with proper care and medication, may have been able to be saved. The most important thing that can be done in terms of starting to mitigate the mental health crisis is to educate yourself and others. By learning the facts of what it is like to have mental illness and being able to rectify common misconceptions about the mentally ill, we will slowly begin to combat the existing stigma. Another way to start combating stigma is to reassess your individual views and beliefs on the mentally ill. Start by being more conscious of your language when discussing mental illness, recognizing the stereotypes that you may have about the mentally ill, and working to understand and show compassion to those in your life who may have a mental illness. This presentation can be summed up in 3 key takeaways. The first is that there will never be global health without mental health care. Mental illness is as real as any physical illness, and despite advances in other global health issues, we still cannot have global health care unless we have increased mental health resources. The second is that stigma perpetuates a vicious cycle of mental illness sufferers not getting help. Stigma is one of the deadliest facets of mental illness, as it drives those who suffer from mental illness away from proper care. Finally, the third and most important takeaway is that you can help alleviate the mental health crisis. By educating yourself on symptoms of mental illness, seeking to understand more about mental illness, and taking steps to change your own individual perspective, you can start breaking down the stigma in your everyday life. Here are my references. Before I conclude, I have a few thank yous. First, thank you to the Global Health Leaders Conference coordinators for giving me this opportunity to present. Second, thank you to my family for listening to my presentation and always supporting me. Finally, thank you to all of those watching. Thank you for taking the time to listen to my presentation, but most of all, thank you for educating yourself about the current global mental health crisis. If anyone has questions pertaining to this presentation, I would be more than happy to answer them. To contact me, please use the email address provided. Thank you.